Hi, and welcome back to Mad-Endo. Today we're going to do segment 2 of what is endometriosis. In the first segment, we touched on what is endometriosis, its definition, and types. In this segment, the second segment, we will cover endometriosis severity, some symptoms, and we'll just touch on surgical removal. So, let's get into it. Severity levels of endometriosis can present differently depending on the level of severity. While the medical classification uses stages 1 to 4, many categorize it as symptoms of mild, moderate, and severe. So some of these symptoms I'm going to go through are in no way encompassing all the symptoms. They are just the more common ones. And some of them, as you can see in mild, when I read it out, it's just going to be like, well, isn't that just like a normal period, right? So let's get into it. Mild would be symptoms like occasional pelvic pain, mild menstrual cramps, or pain during sex. Some may also experience mild lower back pain. Moderate, more frequent pelvic pain, digestive issues such as bloating, diarrhea, or constipation, especially during menstruation, pain during ovulation or urination. Severe, debilitating pelvic pain, heavy periods, chronic fatigue, painful sex, and significant fertility changes. Deep infiltrating lesions may affect other organs such as the bladder, bowel, or rectum. Now, extreme cases of endometriosis are things like thoracic endometriosis, a rare form where the endometrial tissue grows in the lungs, causing catamenial pneumothorax, cyclical lung collapses during menstruation. Isn't that crazy? I really feel for some of you that experience that. I feel like that would be quite scary. So, symptoms include chest pain, coughing up blood, and difficulty breathing. Stage 4 endometriosis, the most advanced stage of the disease, potentially affecting multiple organs, causing deep infiltrating endometriosis, DIE, and leading to complications such as bowel resection, ureter damage, and severe pain. Oh, yeah, that's a lot, man. So that's the symptom list that, as a general overview. It's in no way fully encompassing the symptoms that you can experience with this disease, especially the type that you have. And I think even if, I could be wrong, but the positioning of your uterus, I think if your uterus is actually backwards, you might get more symptoms towards your back than if it was positioned, the right way. So anyway. So that's just a general overview. It kind of gives you a bit of an idea of how to it's good to sort of categorize things so that when you are experiencing endometriosis, you can try and figure out sort of where you're at with the disease yourself, because a lot of managing is knowing your body, knowing your pain levels, knowing what's changing. So trying to categorize things for yourself or looking up how others have categorized it might help you sort of find where you're at with the disease. What level are you at? And then obviously getting medical help. So, types of endometriosis removed surgically, which is excision surgery. Endometriosis can involve abnormal tissue growths that require surgical intervention. These include endometriotic plaques, thickened areas of tissue appearing as lesions on affected organs. These are often removed to alleviate pain, bleeding, and inflammation. 2. Endometriomas, ovarian cysts filled with old blood known as chocolate cysts, which may require surgical removal if causing pain or fertility issues. I'm going to stop there for a moment. Again, this is a really light overview. This is not an in-depth discussion on each one, and I think it would be great if we could do an in-depth discussion, because I can tell you ovarian cysts, I had ovarian cysts, and my right ovary was unrecognizable. It had so many cysts that it had just grown and warped. It was massive. And it just cyst, bleh. So this list is really simplifying things. But again, it's just a high level overview just to give us sort of a scaffolding of where we're at, what sort of types there might be out there. I didn't know all these types for sure when I was first suffering with this. So it's good to, start gaining that knowledge, and we can get into details. We can get into all the types later on, but this is just, again, a high level, just overview, simplified list to give us a starting point. Okay, so 3, fibrous scarring. Adhesions. Bands of scar tissue that can form between organs due to endometriosis. Yep, I had that too. These are surgically removed to relieve pain and restore normal organ function. So I will tell you, I did have stage 4. I was at stage 4. I did have it. My uterus was like starting to, it was going onto my colon and my bowels, and it was adhering, and there was concern about the depth of that adhering, I guess, the depth of it sort of like melting together. Okay. Deep infiltrating lesions. Severe cases where endometriosis grows deeply into the tissues like the bowel, bladder, or rectum. Surgery is often required to remove these lesions, especially if they impact organ function. The topic of surgery is sometimes not as simple as excision. Depending on how endometriosis is affecting you and the severity to which you have it, you may need more than excision surgery. However, getting into those kind of details is something we will broach later on the channel. So, how symptoms vary by type of endometriosis. So, again, starting points, right? These are our building blocks, our scaffolding. This is, again, a high level, not too detailed sort of overview. So, ovarian endometriosis, endometriomas, often causes nausea and vomiting, painful bowel movements, and diarrhea or constipation during periods. Deep infiltrating endometriosis, DIE, causes severe pelvic pain, especially during menstruation or ovulation, pain during sex, heavy periods, and infertility. Peritoneal endometriosis causes general pelvic pain, fatigue, and lower back pain. Intestinal endometriosis causes bowel-related symptoms such as painful bowel movements, nausea, bloating, and constipation. Urinary tract endometriosis causes painful urination, frequent urination, and lower abdominal pain during menstruation. These symptoms can vary in intensity and frequency. If you experience unusual symptoms, tracking them and discussing them with a healthcare provider is essential for proper diagnosis and management. For more information, again, great information sources are the Endometriosis Association website. Now, you've heard me say this in section 1, so I'm going to say it again. I told you I wasn't. Here I am. So, I'm going to touch on a sensitive subject, and you may hear me say this multiple times on this channel. The reality is, at least in the Canadian healthcare system, is that general practitioners are not as informed as they should be about endometriosis, which most often results in not getting diagnosed until things are at a severe stage or not at all. It can result in unneeded treatments or treatments that inflame endometriosis symptoms. Even when your doctor knows you have the disease, more often than not, at least in Canada, they still don't get you the treatment they need, and it's just because they don't know what they should be doing. They don't have the information. They haven't informed themselves. It also often results in GPs being very dismissive of us women, because they don't believe us. They think we're exaggerating, think we're making it up, just because they don't understand the disease. They don't understand that you have endometriosis because you might not be diagnosed with it yet. And then if you are diagnosed with it, they still don't understand the severity and how much this can really affect your life. So I know a lot of you have probably experienced that dismissiveness. I think the majority of us had, and it's quite frustrating. And I can tell you, it's to find a specialist that gets it, to find somebody that understands and validates everything you've been going through. Ooh, it's a life changer. I'll tell you. Yeah. Because sometimes you do start doubting yourself, like, what the heck is wrong with me? And then someone goes, no, this is endometriosis, and I'm really sorry you've gone through that. Shouldn't have gone on this long, shouldn't have gotten this bad. I'm going to help you. Like, ooh, life-changing. And especially, it's hard because you don't necessarily look sick when you have this disease. You don't. And people don't understand. They're like, you have endometriosis? You look fine. Like, why can't you do things? You know? So it can be tough to describe to them or let them understand just how bad it can get. And sometimes people in your life don't believe you. They think you're faking. And that's really hard because you're like, oh my God, man, I have this fucked up disease. You don't understand what it is. It's really like messing with my life. But, again, it's getting better. So what I'm going to say is know your body, know yourself, help yourself as much as you can. Document your own treatments for sure, in as much detail as you can remember. So when you do find a doctor that does understand this disease and can help you, giving them your history in as much detail as possible is only going to help that specialist treat you more effectively and understand where you're coming from. We have to be our own advocates. Now, that being said, things are improving a lot over the past few years, which makes me very hopeful. But there's a long way to go, of course. And we do have a lot of wonderful medical practitioners on our side. They might be few and far between, but they are there. They are fighting for us, and they are growing in number. There are also other professionals that perform supportive treatments on endometriosis patients, like pelvic floor therapy, for example, and they are also advocating for us. It can seem like we are alone, absolutely, but we are not. And more and more and more people are joining in the advocacy. So, thank you for joining me today. Stay strong, and remember you are not alone, and I'm going to see you next time.